Hi everyone. Let's begin with this webinar on 5 power tips towards a healthy pregnancy. I'm Dr. Saxena, an MD obstetrician gynecologist, and you can find out more about me from the website www.drichasaxena.com. I would like to tell you that through this webinar, I'm not endorsing any product, any article or any medicine per se. This is for purely informational purposes. There is this initiative by the name of Let's Talk Women's Health. This would serve as an online women's health clinic, and this is what I've recently ventured out into. This virtual clinic will serve as your one-stop destination to obtain health-related advice and information. This would not be just restricted to pregnancy-related information, but to other things as well, which we will be discussing later in this session. This particular webinar is particularly dealing with tips for a healthy and a happy pregnancy. So that you are watching this webinar, it is either that you are already pregnant or you are planning a pregnancy. So if you're already pregnant, heartiest congratulations for your pregnancy, and let's get ready to welcome your bundle of joy in this world. So today's agenda or the topics for discussion include: the first topic would be pregnancy facts, second is the 3 trimesters of pregnancy, third is the monthly pregnancy checklist, fourth, tips for avoiding acidity or heartburn during pregnancy, and fifth are the tips for maintaining vaginal health. So before we begin, these 9 months of pregnancy you would be preparing to fall in love for a lifetime. So remember this, and this will ultimately help you have a happy and a healthy pregnancy. So are you planning a baby or you're already pregnant? Remember that these 9 months of pregnancy are yours and only yours. Prepare yourself to fall in love forever with your baby. Remember that the most powerful and amazing thing which your body can do is to grow a life inside it. So remember, dear mama, that you are strong, beautiful, and more powerful than you realize that you are. You need to trust yourself and your body to enable your baby to come in this world the way you want it without any complications. So now let's begin. The first topic is pregnancy facts. And in this, the first thing which I'll be taking is the common terminology which is used, and sometimes it may be confusing to you. What does this really mean? So the first commonly used terminology is ANC, which refers to the antenatal care, and this refers to the first and subsequent contacts with the healthcare system when you're pregnant. And these visits, the ANC visits, will also include the diagnosis and management of various pregnancy-related conditions and complications in order to ensure eventually a happy and a healthy pregnancy. Antepartum is the period of pregnancy before the actual childbirth. Intrapartum is the period of pregnancy during which the actual childbirth or the labor occurs, and postpartum is the period of pregnancy or period after childbirth, and within 6 to 8 weeks time the various organs and systems in your body will come back to their pre-pregnancy state. Now, who is an OBGYN? OBGYN refers to the obstetrician gynecologist or a doctor who is specializing in women's reproductive health. Who is a midwife? Now, midwives, they are taking delivery over the world in most of the countries, US, UK, most of the European countries. Midwives are the ones who are taking delivery. In India, this is not the situation, and it is mainly the doctor who is taking the delivery. So midwife is a person or a nurse who assists the women in childbirth, and a trained midwife is usually a certified nurse, and she will call the doctor only if there are any complications or if there are any problems when she is unable to take the delivery. Then there's another concept called doula. A doula is a trained professional who acts as a pregnancy companion for the couple, for the woman and her partner, and provides emotional, physical, and informational support to the new and expectant parents during pregnancy, labor, as well as the early postpartum period. So lots of women, they would like to take psychological help from their husband during the period of labor or during the period of childbirth. But many women, they like to have a doula instead, who is a trained professional. Then there's a concept called dai, which is used in the villages in India, and these are the untrained midwives. So they are not really trained nurses, and as a result, it may be a little dangerous to get yourself delivered through these. So be careful. The second thing which I'll be now talking about is the duration of pregnancy. So normal duration of pregnancy is 280 days, 40 weeks, or 10 lunar months or 9 calendar months. There's often a controversy whether it is 10 months or 9 months. Lunar means the cycle of the moon. So cycle of the moon, usually it occurs over 28 days. So a lunar month consists of 28 days or 4 weeks total. A calendar month, on another hand, it comprises of 30 to 31 days except for February. So a calendar month is not equal to 4 weeks but approximately 4.3 weeks. So if you calculate, then the 40 weeks, they equal to either 10 lunar months or 9 calendar months. And the normal duration of pregnancy, or what we call as term, that the lady or you have delivered at term, that means the duration of pregnancy is between 37 to 42 weeks. If it is less than 37 weeks, it becomes preterm. If it is more than 42 weeks, it becomes postterm. So lots of women, they ask me, how do we know about our expected date of delivery? In most of the cases, your doctor or your healthcare provider will calculate this EDD or expected date of delivery for you. But if you want to calculate it yourself, you can also do that. All you have to do is add 7 days to the first day of last menstrual period and count forward 9 months. So for example, if your LMP or the first day of your last menstrual period, it occurred on say 1st of January. So if it occurred on 1st of January, you add 7 days, so this becomes 8th January, and then you count forward 9 months. So Feb, March, April, May, June, July, August, September, October. So it becomes 8th of October. That becomes your EDD. Let's take another example. Say your LMP was on 28th January. So if it is on 28th January, then you count forward, you add 7 days to 28th January. So that becomes 29th, 30th, 31st January and 4th February. 1, 2, 3, 4. So that makes it 7 days. So 4th of February. Then you count forward by 9 months. So Feb. If you count 9 months from Feb, that becomes March, April, May, June, July, August, September, October, November. So your expected date of delivery becomes 4th November in this case, if your LMP was on 28th January 21. So what happens, we just discussed this previously also, if the labor occurs before or after the due date. So if the labor occurs before the due date, that is 37 weeks, that is known as the preterm labor, and the baby which is born in this case becomes a preterm baby. And usually the babies are viable after 20 weeks. That's a different matter, that the nurseries and the intensive care facilities in the hospital, they cannot save a baby which is 20 weeks. And usually a pregnancy which is 28 weeks or more than 28 weeks would be mainly saved. So if the baby is born before 28 weeks, that becomes extreme preterm. Between 28 to 31 weeks is very preterm. And between 31 to 37 weeks becomes moderate or late preterm, and these are the babies which are usually saved by the nursery or the healthcare facilities. So what is a post-term or a post-mature pregnancy? A post-mature pregnancy or a post-term pregnancy is a pregnancy continuing beyond 2 weeks of EDD or greater than 294 days or greater than 42 weeks. So the second topic is, which commonly women ask, what are the trimesters of pregnancy? So pregnancy, the duration of pregnancy of 40 or 42 weeks of pregnancy, they are conventionally divided into 3 phases, and each of these phases they will be having different symptoms, and the baby is in different stages of development during these phases, so they've been divided accordingly. The first trimester is from conception, that is the time you conceive, until 12 weeks. The second trimester is from 12 weeks to 27 weeks. Third trimester is from 28 to 42 weeks. So if you have any questions, on the side you will have a panel where you can ask your questions. So you post your questions there and I'll definitely get back to you on that. The next topic or topic 3 is the frequency of ANC or the antenatal care visits. So this is another question which is commonly asked: how frequently should I visit the doctor when I'm pregnant? So as per the WHO guidelines, 4 minimal visits are mandatory for any pregnant women. First one at 16 weeks, second one at 24 to 28 weeks, third one at 32 weeks, and fourth at 36 weeks. These are the minimal number of visits. That is what is extremely essential, and you should not at least miss these visits. So if everything goes ideal and the situation is absolutely fine, and under ideal circumstances, if you are able to visit the doctor, then as per the WHO guidelines, WHO is World Health Organization, the women should visit her doctor every monthly basis until 28 weeks of gestation. After 28 weeks of gestation, you can increase the frequency to every fortnightly till 36 weeks. So till 36 weeks, fortnightly. And after 36 weeks, it becomes on a weekly basis. So this is under the ideal situations. Otherwise, under normal circumstances, we know that most of you must be working and you may not be able to find out so much time for your antenatal visits. So in that case, minimal of 4 visits, and in these visits, the first time when you detect your pregnancy, a visit to the doctor is not actually required. It's not mandatory. If you've done a home pregnancy test and you've confirmed that you are pregnant and you remember your last menstrual period, even if you visit the doctor later, it is fine. So the next topic I'll be discussing is checklist for 9 months of pregnancy. So here I'll be discussing the things which need to be checked in each of these months of pregnancy, and this includes the medical advice which should be given to you, the lifestyle changes which you need to incorporate, and tips for a happy pregnancy. Tips for a happy pregnancy is basically the tips which you can follow in order to develop a better bond with your partner, with your baby, and this will eventually help in having a happy and a healthy pregnancy and a happy newborn baby. So now let's begin the pregnancy journey monthly basis, that what all you are supposed to do. So the first month of pregnancy, or first to 4 weeks, so the medical advice which you require to follow during this period is, you must confirm your pregnancy with a positive pregnancy test. Again, all of you know about it. These are commonly available. This is the time when you need to research and choose your obstetrician gynecologist who will be providing you care, or it could be your midwife or your healthcare provider. Book your first ANC appointment, which is usually booked at the time of 6 to 10 weeks. And in case you're not able to book this appointment, it's okay, chill, relax. You can visit the doctor later. And this is the time when you should start also taking prenatal vitamins And prenatal vitamins basically includes folic acid. Lots of products are being endorsed that they help in fetal brain development and baby's health and all that. All that is not required. Folic acid is more than sufficient, and in fact folic acid should be taken even if you are just planning a pregnancy and you are not actually pregnant, because folic acid will help in having a healthy baby, and it will help in preventing the occurrence of complications which are known as the neural tube defects in the baby. The lifestyle changes which you can adopt during this period is, you should focus on having a healthy diet and a healthy lifestyle, which all of you already know. You need to quit smoking in case you were smoking or you were having alcohol prior to being pregnant. Then you should immediately cut it off. You should just immediately stop smoking or having alcohol. Don't even reduce the amount, just stop it, because it may be harmful for your baby. This is the time when you need to drink in a lot of water and eat fresh fruits and vegetables, again to prevent constipation and to have a healthy pregnancy. This is important. Assessment by your obstetrician gynecologist. Suppose you do visit your doctor, there are certain things which the obstetrician gynecologist may get done, and this includes a few lab tests, which basically includes the blood test, and these include the blood grouping, the hemoglobin, some other tests, screening for infection, hepatitis B, C, HIV. This is done at some places. Again, not essential. If your doctor recommends, please do get it done. Again, an ultrasound examination in the first 4 weeks is not essential. But suppose you're not sure about your dates, your doctor may sometimes order it, because an ultrasound examination done at this period of time will give you the most accurate estimation of the gestational age. So if the doctor recommends, you must get your ultrasound examination done. Also, talk to your doctor before having any medications. Taking any kind of medicines in pregnancy, especially the first trimester, can be dangerous, so please avoid that. And now, as per the latest guidelines and as per the international consensus guidelines, which were published in the Nature Reviews in September 21, they are even against taking paracetamol. So previously, during the first month of pregnancy, paracetamol was considered safe, and pregnant women, they were safely prescribed paracetamol. But now, as per the latest guidelines, paracetamol is also to be prescribed in minimum dosage for minimum duration of time, because this also may have its own adverse effects. So before taking any kind of herbal or any kind of other complementary therapy or any medications, even if it is a cream or it is a vaginal suppository, please do consult your doctor. So now, what should you do in the second month of 5 to 8 weeks? So medical advice to be followed is, this is the time when you will be interviewed. Interviewed means the doctor will take your complete medical history, complete history in details, and also carry out a clinical assessment to identify any risk factors. In absence of any maternal or fetal risk factors, a cesarean section is not usually required, provided that there are no maternal or fetal risks involved. And in absence of any such risk factors, all couples can aim for a natural childbirth. And this is because pregnancy is a normal physiological process, and it has been devised by nature, and nature has devised it in such a way that a lady can give birth to a child requiring minimal medical assistance. Every couple should actually or ideally aim for a natural childbirth. And we'll be discussing in future sessions about how you can physically and mentally prepare in anticipation of a natural childbirth. Even in later pregnancy, there may be sometimes a complication occurring which may eventually result in a requirement of a cesarean section, but still everyone should aim for a natural childbirth. Then the lifestyle changes to be done during this month like we discussed previously, this is the time when you may have symptoms related to morning sickness. Morning sickness basically means nausea and vomiting, and this is usually commonly experienced in the morning, so it is known as morning sickness. And this is a symptom which may be experienced by nearly 75 to 80% of women during this period of pregnancy, the first trimester typically. And you should not be worried about this. A little nausea, vomiting is absolutely fine. Sometimes, very rarely, this may become very severe, and this may even require hospitalization, and under that situation the condition is known as hyperemesis gravidarum. Again, you need not worry so much about that because that is a very rare situation. And what you can follow or what you can do is you can keep a stock of items such as ginger, lemon drops, saline crackers, mints, ginger ale, lemonade. So sipping on ginger ale, lemonade, sip by sip, it helps in relieving morning sickness. Or sucking onto candy, hard candy, it could be whatever flavor you like, it helps. So you need to decide what really helps you out with morning sickness. And another thing which lots of women, what benefits them is nibbling onto something solid, maybe a biscuit which could be sweet or salty as per your taste, or a dry toast. Early in the morning, as soon as you get up, even before brushing your teeth, if you nibble onto this, usually it helps in preventing morning sickness. So a tip for happy pregnancy. Now, dental problems, you can understand, they go hand in hand with pregnancy, again because sometimes you may have to compromise on brushing your teeth. Like I just mentioned, that early in the morning, just before brushing your teeth, if you nibble onto something, this may help prevent morning sickness. So dental health at times may be compromised during pregnancy. So it is important to get a dental checkup done during this time because this is the most appropriate time. So if any procedure is involved or if any procedure is required, for example, tooth extraction, or a cavity needs to be filled, or a root canal needs to be done, or anything, then your doctor or your dentist can do it at this point of time and it is completely safe. So now let's talk about the third month or 9 to 13 weeks. So this is the time when you can announce your pregnancy if you have not done it before, if you have not told your friends or family about it. This is the time because there are nearly 50% cases when the miscarriages may occur in the first 2 months. So if your pregnancy has sustained till the third month, it is extremely unlikely that miscarriage will happen now. So this is the best time when you can disclose about your pregnancy to everyone. This is also the time when you can tell your doctor to make you listen to the baby's heartbeat at the time of examination when she's hearing your heartbeat with a Doppler ultrasound. Also, this is the time when you should get the combined first trimester screening for Down syndrome done. And the combined screening for Down syndrome, it basically comprises of 2 tests. Down syndrome is a problem which can occur in the babies, and this is usually seen in the mothers who are more than 35 years of age. Before 35 years of age, if you're pregnant, then occurrence of Down syndrome in the baby. Again, Down syndrome is a chromosomal abnormality, and this is usually associated with increased mother's age more than 35 years. So even though it is more common after 35 years of age, universal screening for Down syndrome is done for all the women during pregnancy, and it can be done in the first trimester or it can be done in the second trimester. The first trimester, if it is done, it involves 2 tests. One is the ultrasound and the other is the blood test. So an ultrasound examination and the blood test, they need to be done. So lifestyle changes which you need to adopt during this time includes moisturizing your belly, thighs and legs with belly butter. This is to prevent the occurrence of stretch marks, and belly butter can be bought from any shop, any market. Also, you must avoid the use of hot tubs, saunas, steam rooms, intense hot water bath, or anything which could raise your body's temperature, because this may be harmful for your baby. So, tip for a happy pregnancy: this is the time when your baby bump is kind of growing, and this is the time that you may feel slightly uncomfortable while sleeping, so you may require to buy a body pillow. Again, this can be bought from anywhere. Pregnancy is a time when you can commonly experience heartburns, and the reason is the pregnancy hormone progesterone. This will cause relaxation of the sphincters and the muscles in your food pipe, and this may result in acid reflux from the stomach to the food pipe, resulting in heartburns. So it is a good idea to eat smaller meals more frequently. So instead of having, say, 3 big meals in a day, have small 6 meals and have it at frequent intervals. So now coming to the month 4 or 18 to 22 weeks. So the medical advice which needs to be followed during this time is that if suppose the screening for Down syndrome was not done in the first trimester, this is the time when you can talk to your doctor and she will order the screening test for Down syndrome. And in the second trimester, the screening test for Down syndrome, this will just involve measurement of some blood parameters. So it is just a blood test which will be done. No ultrasound for screening of Down syndrome is done during this time. Ultrasound examination, however, may be required if your doctor feels so, because second trimester ultrasound is most effective in ruling out any fetal anomalies. So if your doctor feels the requirement, then she can order a ultrasound examination at this time. The lifestyle changes which you can adopt during this time includes prenatal yoga, stretch exercise, increase the intake of calcium and iron in the diet, and start taking iron and calcium supplements if required. As I previously discussed, in the first trimester you may be suffering from morning sickness and you may not feel like taking in something. So that time, whatever you feel like taking, you should just take that based on whatever you feel what you can take in, and don't worry about the nutritional value. And in first trimester, please don't start taking iron or calcium, because iron as it is will result in gastric problems, can result. So second trimester is the best time to focus on your nutritional requirements. And more about nutrition during pregnancy I'll be covering in later subsequent webinars, so stay tuned for that. So tip for a happy pregnancy: you can take photo of your halfway baby bump, because your baby bump is almost halfway during the second trimester. You can take a photograph, put it in your scrapbook, or you can put it on your Facebook or your family album, whatever suits you. Also, since now the baby bump has started growing and you've started putting on weight, the clothes may start getting tight, and this is the time for you to go on a shopping spree and to do shopping for the maternity wear. So month 5, which is 18 to 22 weeks. So medical advice which can be given in this period is, the doctor can tell you about the signs of preterm labor, because after 20 weeks, as I discussed previously, the baby is viable, and the delivery of the baby before 37 weeks from 20 weeks onwards is known as preterm birth. So if you experience any of the signs of preterm labor after 20 weeks, you must immediately consult your obstetrician gynecologist. And these basically include the occurrence of labor contractions, and there could also be sometimes water breaking or gush of fluid. Again, we'll be discussing about this in depth later sessions. So lifestyle changes which you can adopt during this time is practicing Kegel exercises. Kegel exercises are basically the pelvic floor exercises which help in strengthening the muscles of your pelvic floor. And pelvis is basically an area which supports your womb, and as a result it plays a vital role at the time of your delivery. So if the pelvic muscles are strong, this is going to facilitate the process of delivery, and also it may not require giving you a cut, a surgical cut, which is known as an episiotomy, which is normally given in the perineum at the time of delivery in case your muscles are not stretching enough. So if you have already done these exercises, you probably would not require an episiotomy. Again, discussion related to Kegel exercises I'll be doing in subsequent sessions also. And tips for a happy pregnancy to be followed during the 5th month include that this is the time you can think for baby names, because usually the baby's sex is identified by about 14 to 18 weeks of gestation. In India, it is not legal to disclose the baby's sex, but in some countries, the baby's sex is disclosed. So anyways, if you know the baby's sex, you can think of the name based on the sex. Otherwise, you can shortlist 2 names, one for male or one for female. Then you can also plan a baby moon. This is an interesting concept which I recently just came across. This basically is a recent trend where you can plan a romantic gateway with your partner, and this is the exact time when you can plan this romantic trip with your partner, because later when you venture into the 3rd trimester, any kind of travel is not really recommended. And when the baby is born, both you and your partner may get too busy taking care of the baby that you may not have time for each other so much. So this is the best time to plan a baby moon. So the 6th month of pregnancy, or 23 to 27 weeks. The medical advice is that during this time you should start counting your fetal movements as instructed by your doctor. And counting fetal movements, again, I'll be taking it as a separate session. This is another topic which lots of women, they ask about when do we normally experience, when would I normally experience the movement of the baby. So in a normal woman who has been pregnant before, she's known as a multigravida. And multigravidas, they tend to feel the fetal movements or the movement of their babies earlier. So they may feel the fetal movements by about 16 to 18 weeks of gestation. A primigravida, or the lady who is pregnant for the first time, she may experience it a little later, and it is about 18 to 20 weeks. So both are absolutely normal. So if you are pregnant for the first time and you are not able to immediately feel your fetal movements by 16 weeks, it's okay. 18 to 20 weeks is fine. You need not get scared or afraid that why you are not feeling the baby's movements. And we will be discussing in depth about how to count the baby's movements. The lifestyle changes which can be adopted during this period is that in case you are planning any last minute travel, then you can do that before the 3rd trimester begins, because I discussed previously also 3rd trimester is not the perfect time to travel. So you should avoid any kind of traveling during the 3rd trimester. Tips for a happy pregnancy: you can book a birth photo session. And I have seen lots of ladies, they book these fantastic photo sessions and they flaunt their baby bump and they wear beautiful dresses, and they and their partner, they have this photo session, and it would last for their lifetime. Also, this is the time when you should begin planning, setting up and decorating your baby's nursery. So now month 7, or 28 to 31 weeks. So the medical advice to be followed during the 7th month. Now you are venturing into your 3rd trimester. So this is the time to begin planning your delivery. You can find a birth doula if required. If you feel that you require a birthing companion and your husband may not be available, or he is maybe just scared of everything and he doesn't want to accompany you at the time of your delivery, then you can probably have a birth doula if required. Also, you can develop a birthing plan in coordination with your healthcare provider. This is the time when you must research childcare, and you can consider looking for a pediatrician, because once your baby is born, a pediatrician would be required. Also, this is the time when you should get the injection tetanus toxoid given, especially if you are in India, because in India 2 doses of tetanus toxoid are given to pregnant women starting from the 7th month. 7th month you get 1 dose, and after 4 weeks you can get a second dose of tetanus toxoid. Suppose you are a primary gravida, that is, you are pregnant for the first time, 2 doses of tetanus toxoid are given. And if you are a multi-gravida, you may just require 1 booster dose, especially if you were pregnant maybe less than 2 years previously. And you just need to consult your doctor. She'll tell you exactly whether you require a single dose or you require 2 doses of tetanus toxoid. Tetanus toxoid is not given in all the countries. So the lifestyle changes which can be done during this period of time is, talk to your employer about maternity leave, because now you are almost nearing your time of delivery. So this is the correct time to plan your maternity leave, and you can talk to your employer about that. Eat a high fiber diet to avoid constipation and hemorrhoids. Again, because in the 3rd trimester the bump is growing massively, and the growing womb may press upon your intestines, especially your rectum, and this may result in constipation. So constipation is likely to occur. It is a very normal finding in pregnancy, and to avoid this, the best thing which you can do is to have a diet which is rich in fiber and drink lots of water. So tips for a happy pregnancy: schedule your baby shower before 36 weeks. 36 weeks is the best time when you should schedule your baby shower. Baby shower is Godh Bharai in Hindi. And this is also the time when you can help your partner feel the baby's kick, because you till this time would be conversant in appreciating when the baby is kicking. And if you now help your partner or your other family members to feel the baby's kick, this will help in developing a bond with an unborn baby, and this is the concept of Garb Sanskar, resulting in happy and a healthy pregnancy. We will be discussing about Garb Sanskar in later sessions. So month 8 or 32 to 35 weeks. Now your pregnancy due date is almost nearing. So the medical advice to be followed during this time is to pre-register yourself at the hospital for delivery. Also, the lifestyle changes which you can do during this time is stock up on groceries and household essentials, because anytime now you may have to get yourself admitted for your delivery. So you need to be prepared that other people in the house, they have supply of groceries and household essentials. So this is the time when you can do the stocking up. Tips for a happy pregnancy: you had already planned your photo session in the 7th month. This is the time when you can take maternity and family photos. You can store, return or exchange the baby shower gifts, and you can send off thank you notes. Again, this is based on your personal preference. If you think it is possible to return or exchange baby shower gifts in case you don't like them, then it is up to you. Otherwise, you just store them and you send off thank you notes to the people who have sent you the gifts. Also, this is the time when you buy the baby clothes and linen. Now coming to the final month or the 9th month, 36 to 40 weeks, and this is the time when the delivery may occur, and this is the time when you need to know about the various signs of labor, and your healthcare provider or your obstetrician gynecologist may tell you at this point of time the signs of labor. Signs of labor is, one is the uterine contractions or the labor pains, and these pains, they will not be present continuously. You will feel pain occurring, and then it will vanish, and again it will come and it will vanish. And slowly as the labor progresses, the duration of these contractions increases and the frequency also increases. And accompanying these labor contractions would also be the changes which are occurring in the neck of your womb or the cervix, because during this time the neck of the womb or the cervix, it starts opening up in anticipation of natural childbirth and in anticipation of pushing the baby out. The birth canal or the mouth of the birth canal starts opening up. So during this time you may also experience rupture of membranes, because as the mouth of the birth canal opens, a bag of membranes is formed, and this eventually may burst, resulting in gushing of fluid outside your body. So if you experience this, you can imagine that your waters probably broke, and this is nothing to be scared about. This is just that the labor is approaching and labor is very nearby. Also, this is the time when you need to finalize your birthing plan with your healthcare provider, because till now she'll know if there is any abnormality. Suppose there is an abnormal placental position or abnormal baby's position and you require a cesarean section for sure, then in that case your healthcare provider will tell you for that, and she may even set up a date for your elective cesarean delivery. The lifestyle changes which you need to follow during this period: prepare yourself for delivery prior to 42 weeks. So as I told you previously, pregnancy is not a sickness. It is a physiological process which is occurring, devised by nature. So you need not look haggard, or you need not look as if you are very sick or you are in pain. You must prepare yourself to look at your best, so that your baby visualizes the best version of you when the baby is born. And so this is the time when you can groom yourself, you can prepare for the final appearance. This is the time when you can get a haircut done. If you require a spa or a massage, this is the time when you can get that done. You can take care of your nails, your skin during this time. So if whatever you require, you feel that you need a manicure, pedicure or whatever, you can get this done during this time. Also, it is important during this time not to take stress and to sleep properly, and at least for 8 hours every day you must sleep. If possible, then you must also sleep for 2 hours during the afternoon. Tips for a happy pregnancy: this is the time to pack your hospital bags. Be ready for signs of labor. So anytime you feel you might have to go to the hospital, so keep your bags ready. Also, this is the time when you should get your home and your car deep cleaned, because once you land up in the hospital, you don't want to come back to a home where there's dust and your baby might get infected, or your car is having dust which may result in infection in your baby. So it is best to deep clean your car and home during this time. So next topic 4 is avoiding heartburn or acidity during pregnancy. We have discussed previously that why heartburns are common during pregnancy. Again, this is something which you may commonly encounter, so you should take steps to prevent the occurrence of heartburns during pregnancy. So one is avoid stress and don't smoke. Exercise at least for 30 minutes a day. Avoid sleeping on your back. Again, during pregnancy, especially starting from the 2nd, 3rd month onwards, the best practice is to sleep on your side, because this will also help in improving the circulation, the blood circulation to your womb, and will prevent you from fainting because sometimes when you sleep on your back, this may compress your blood vessels and may compromise the blood supply to your growing baby, and it may sometimes also result in fainting. So the best is to try to sleep on your side. Wear loose clothing, because again the tight clothing may make you feel uncomfortable. Keep yourself hydrated. Eat small portions of your meals several times a day. Ginger tea works very well in preventing acidity, heartburns and even morning sickness. When you're lying on the bed, try to keep the head of the bed elevated. You can use several pillows to do that. Consume apple cider vinegar. This is another thing which helps. If you can add 1 teaspoon of apple cider vinegar in a glass full of water and you take sip by sip, this also helps in avoiding acidity and heartburns. The last topic for today's discussion, tips for maintaining the vaginal health. Again, to maintain the health of the vagina is important during pregnancy because this is the route through which the baby would be eventually born. And as a result, many women, they start taking extra care. But please do not do that. Do not wash more than twice a day. Try not to do douching. Douching solutions are available, and douching solutions basically help in washing out the contents of vagina, and when you wash out the entire contents, it may also result in washing out of the useful bacteria which are present in the vagina, and this may make it more prone to develop infections. So please do not douche. Use hygiene products containing soothing ingredients. The vaginal pH is usually on the acidic side. So avoid using harsh chemicals, avoid using soaps, because most of the soaps, they will be having an alkaline pH, and this may disrupt the environment in the vagina, making it more prone to develop infection, and it may also result in irritation or pain there. So best is to avoid using harsh soaps. There are certain preparations available which are typically meant for vaginal pH. So you will have several feminine washes, and they usually have pH which is acidic or neutral. So try using these products. Also avoid using vaginal deodorants and strongly perfumed products because they can cause irritation in the vagina. Wear clean underwear every day. This again is obvious. When you have passed your stools, try wiping if you're using a toilet paper or whether you are using water. Avoid wiping from back to front and try wiping from front to back, because when you are wiping from back to front, some of the microorganisms present in your stool, you may take it to your vagina, and this may result in development of infection. Another important thing to follow during this time is, if you experience any kind of unusual discharge or any genital irritation, please do not use any kind of suppositories or any kind of creams by yourself before consulting your doctor, because this may not be safe for you. So please don't do anything down there before you consult your doctor. So that finishes today's webinar, and I hope you really enjoyed watching this session, and I hope you learned a lot from this. And I would like to thank you all for being here and for attending this session. And as I told you before, if you want, you can put your questions. On the right hand side, you can see an option for putting your questions. You can please put your questions there, and I'll personally reply to all these questions. Also, if you are interested in getting all these slides and you want to see them again, you can scan the QR code here. You can scan it using your Apple iPhone directly through your camera, or you can use the Android phone. You have to have an app for the QR code, and you can scan this QR code and you'll reach the exact place where you will get these slides. Also, if you have any questions, you are more than welcome to please write these questions to me. You can write here on the right hand side, or you can join the private Facebook group related to Let's Talk Women's Health. You can scan this QR code, or you can press on this Facebook icon, and this will take you to the Facebook group page. This is a private group, and this is also linked to my WhatsApp number. So whatever discussion we'll have, this will be between us only. It'll be completely private and it'll be completely secure. So you can join this Facebook group. If nothing is working, then you can use this URL which I've given here to access the Facebook group, or even in the search bar of Facebook, you can just type Let's Talk Women's Health and it'll take you to the Facebook group. So please do join that group, because as I told you previously, that stay tuned for coming up webinars. I'll be posting there all the information related to the coming up webinars, coming up offers, coming up bonuses, coming up freebies. There is a lot to discover. So if you are on the Facebook group, you will keep getting that information. So stay tuned for your webinars, the future webinars. And whether you want a natural childbirth without the use of any medications or not, provided that there is no fetal or maternal risk factors involved which require a cesarean section. Otherwise, it is up to you, and you need to physically and mentally prepare yourself. You need to decide and prepare yourself in anticipation for natural childbirth. And I can help you select your birthing plan and give you tips related to physical preparation and mental preparation, so that you are ready to welcome this bundle of joy in the world. So for this, just stay tuned. There is a webinar which will be coming up in first week of December, and stay tuned for that. This will be talking specifically about the natural childbirth. So as I also told you previously, that this Let's Talk Women's Health is an initiative by me, and this is a virtual health clinic, and here you can discuss several issues which are related to women's health. It could be your pregnancy related issues, it could be menstrual abnormalities, it could be gynecological problems, it could be issues related to menopause and bone health. So any issues which are related to your pregnancy, this could be your first pregnancy or your nth pregnancy, or whether you are planning a natural childbirth or you are planning a cesarean section, I would have the exact advice for you. And if you are having some kind of menstrual abnormalities, you are having excessive bleeding during periods, or there is abnormal bleeding or irregular or scanty periods, then also I'll be able to give you some advice. Or if you're facing any kind of gynecological problems such as infection, pelvic pain, PCOS, fibroids, gynecological malignancy, sexual problems, then also I'll be able to help you. Or if you're facing issues related to menopause or bone health, menopause, you already all know, is a natural process and may be associated with several problems. So I may have advice for you for that also. And for being here till now and listening to me, I would like to give you a bonus. And the way to claim your bonus is you refer 2 friends to join the Facebook group, which we just spoke about previously. So if you can just force 2 of your friends to join the Facebook group, you can claim this bonus. You can mention on the Facebook group itself that you have referred these 2 friends, and if they join the Facebook group, in that case I'll send you a copy of this monthly pregnancy journal, which has a pregnancy checklist, pregnancy facts, and basic medical terminology. You can use it as a scrapbook throughout your pregnancy, and you can fill in whatever milestones you experience. So to claim this, just refer 2 friends. And before I end this session, I would just like to tell you that this is the information where you can contact me, the website address, the email address. You can write to me, you can join the Facebook group, you can connect to me through any of these ways. And before I end, just thank you for being here, for listening to me, and I welcome you all to the future sessions which I'll be having. I'll be putting notification about those future sessions in my Facebook group. So please do join and please do come in. And all the best for your coming pregnancy. Thank you so much.